Welcome, everyone. It's a pleasure to welcome you all to the first webinar from the Global Webinar Series that will discuss coalition building. This is the first of a quarterly webinar series that will focus on advocacy. And first of all, I would like to invite you to introduce yourselves in the chat, telling where you're joining from and what else you would like to share from yourselves. And while you do that, I would like to happily introduce you to our speakers from 5 countries who work across GHAI's programs. So on food policy, drowning prevention, road safety, and cardiovascular health. So it will be a roundtable discussion. We would like you to participate and send your questions. We are going to have some initial questions, and then we are going to have, in the last moment, we're going to have a space where you can share your questions too. So from Brazil, we have Rosa Mattos and Paula Bortoletto, who will talk a little bit about the Alliance for Adequate and Healthy Food. Also, we are going to be joined by Francine Charles from the Heart and Stroke Foundation of Barbados and their coalition that advocates for policies to address childhood obesity. From Vietnam, we have Huyen Doan, who will talk about a coalition in Vietnam that works on child drowning prevention. We'll also be joined by Sanjay Pandey, who will share how a coalition in India has advocated for front of package warning labels. And finally, we are also going to be joined by Gemma Granados, who is from Colombia and will share the experiences of a coalition advocating for stronger vehicle standards. So I just would like to share with you a little bit more from our wonderful panelists today. So Paula is currently a postdoctoral fellow at the Institute of Public Health at São Paulo University and works as a researcher at NUPENS and at the Josué de Castro Chair at the same university. She's also a technical consultant for healthy and sustainable food program at Idec. And she has been working in several positions there since 2013. Welcome, Paula. I also would like to share a mini bio from Rosa Maria Mattos. She is journalist and communications advisor in ACT Promoção da Saúde, working in healthy food policy agenda. Rosa is a member of the communication team of the Alliance for Healthy and Adequate Food and has been working with social movements, NGOs, and social rights networks for the last 7 years. She's doing her master's degree research in the communication work led by the National Coalition of Women Food Producers called the March of the Daisies. We also would like to welcome Sanjay, who is a national policy advisor with GHAI in India, has over 25 years of experience and is a doctorate in economics from IIT Kanpur. He is in his different stints with various organizations has majority contributed towards providing strategic vision, leadership, technical expertise, and management oversight to fulfill the diverse managerial and capacity strengthening requirements of the policy development and health system strengthening. Welcome, Sanjay. Also, I would like to introduce you to Gemma Granados. She is a communications professional with a master's degree in public policy, 15 years of work experience as a communications manager and public relation strategy for health promotion, human rights, and gender equality in Colombia. She also has expertise in developing effective advocacy initiatives to improve the well-being of adolescents, youth, and women of humanitarian situations. And since 2019, she is the in-country coordinator for the road safety program in Colombia of the GHAI. And we also have today Doan, Huyen, who is the country director for program in Vietnam, including child drowning prevention, tobacco control, and cardiovascular health. She provides a strategic vision and leadership to achieve the legislative and program objectives in Vietnam. And lastly, but not least, Francine Charles, who is the program manager for childhood obesity prevention at the Heart and Stroke Foundation of Barbados. She is a communications professional with over 26 years of experience in the fields of journalism, broadcast media, public relations, and marketing and communications strategy. She has worked regionally with both private sector companies and non-governmental organizations with a strong leaning towards developmental projects. Well, you can see that we have a wonderful group of people to give us this good time this morning and afternoon for some of you. So I just would like to start our section with with Ana Paula, Sanjay, and Hema. And we are going to have a 10 minutes discussions, and then we are going to go to the section number 2. So for our first section, we are going to talk a little bit about the structure of the coalitions. So I would like you to go back a little bit on time and think about the history of the coalitions that you are part of in your countries. And I will start with Ana Paula. So within the context of Brazil, what were the key elements that enabled the development of this broader coalition, the alliance, made up of different civil society organizations working around common policy goals?
Thank you, Vanessa. Good morning, good afternoon, everybody. It's a pleasure to be here to share a little bit of our experience from Brazil and to learn from other experience around the world. Well, the Brazilian Alliance for Healthy and Adequate Food was launched in 2016. So many years before that, in Brazil, we already had a strong civil society on the food and nutrition security agenda that was responsible to build many public policies, for example, on the Zero Hunger program here and many others. And also, we had a previous experience of a short period coalition for the approval of a marketing restriction regulation of unhealthy foods here in Brazil, which was suspended, but the movement created around this issue was important for the process. And also after that, in 2014, there was a new front created with members from the civil society, academia, and some technical staff from the government that identified the need to push forward regulatory measures for healthy diets, including labeling, marketing restrictions, taxes, and school environment regulations. And this group also discussed about the importance of having a strong civil society movement independent from the government to work on these policy agendas. During that time, we also had the publication of the Brazilian Food Guide, which also helped to build the momentum for the healthy diets agenda. And in the same time, also Brazil was no longer in the FAO hunger map. So at that time, we had an important political space to improve, to push forward more on food and nutrition, as we already were improving the hunger and food insecurity agenda. Of course, now we had a different scenario, but at that time it was different. And also, I would add on this process, the political context in Brazil was deteriorating very fast, with right-wing movements growing and we saw that the political space that the civil society had was at risk. So it was the moment to have a strong civil society coalition so that we could face with this political scenario. Considering all these previous experiences and the political context, we saw that we needed to have a strong coalition that could work together for common goals around the agenda of healthy and adequate diets. So it was possible to build this agenda in a broader context. And finally, we also learned from the experience that Mexico had in their alliance and adapted for our context.
Wonderful, Anna. Thank you so much. So it was a sum up of many previous activities and movements that allowed you to get there, right? So Sanjay, it's my understanding that the India Coalition currently is advocating for front of package warning labels and is extremely active. So what has been the main catalysts in this form of engagement? Could you share with us, please?
Thanks, Vanessa. It's really a wonderful discussion. Thank you so much for inviting and sharing our learning in this space. So if you ask me what has been the catalyst, so the number one thing would be that the way it has been coordinated, that coordination, the motivation, because how each organization have been kept motivated. The third would be the sharing of knowledge and information, the global knowledge and information by GHAI from the headquarter and all. That is very important into that. And the major thing has been the common purpose, the common objective, the common goal, which has really binded all the organization and individuals and the network members into that. So the common goal is being the how to get the warning label as a front of package label, which should be mandatory, and the WHO zero cutoff points can be there on that. So this is a common kind of understanding among all the constituent members on that. And in this group, we have a diverse voices, and that's the strength, because all organizations, they come with the strength of that. We have a consumer groups and their networks throughout the country. We have the Breastfeeding Promotion Network of India. We have the advocacy network of the nutritionist. We have the academic institution like All India Institute of Medical Sciences and all the colleges there on that. And similarly, we have the other advocacy organization. And all this organization, they have joined hands together on that. And also, one of the points which I will mention here as the members, they shared values. And those values are primarily the commitment, the passion through which they themselves, they work on that, the transparency, the trust, the mutual trust among each other, which is really there on that, and common voice with different content and with different representation of the constituency. Somebody is representing the youth and marginalized women. Somebody is representing the consumer, rural, urban. So that different voices really becomes more stronger. And that's really forced the political people to hear these voices. Even the left wing, right wing, all the central political powers, everybody, they heard this voice and they said yes to this thing. So that's the one of the major these things. And in the last 1 year, I will stop here, that it has really come up in a very accelerated pace into that. And GHI as a catalyst, as an invisible catalyst, I would say, have really offered a lot of support from behind in that. And you need that in any campaign mode on this, and including media into that. I will stop here and will be happy to really share more questions on that. And the GHI India team as well as the headquarter team, I'm considering that because the global knowledge and expertise and sharing, That was very key and important to this network and this coalition. Yeah, thank you.
Great, Sanjay. This is great to hear. Hema, I would like you to invite you to share an example on what role the coalition in Colombia has played in your advocacy campaign. Just before that, just would like to let everyone know that we have interpretation available. Okay, please, Hema.
Gracias, Vanessa. Buenos días a todos.
Thank you, Vanessa. Good morning, everyone. I would like to share the experience of the Vehicle Safety Coalition in Colombia that we have been supporting since 2019. Vehicle Safety, when GHAI and our partner of the BIGRS initiative and GRSP came to Colombia to propose a coordinated effort vis-a-vis the improvement of vehicle safety in Colombia. We found that this was not something and other issues relative to road safety, sustainable mobility, infrastructure issues, speed, but not vehicle safety issues. So it was truly a challenge to be able to first identify the organizations that would be interested in supporting this agenda and to create a coalition with these organizations. The truth be said, the biggest challenge back then was, in fact, that these groups that were given a grant from GRSP and from GHAI to conduct a very successful mass media campaign would be considered a group, coordinated and articulated as a group, and that shared a joint vision, that could agree on common policy objectives, that would be able to identify their strengths, and also to be able to value the articulated work that would contribute to a bigger effort more than an individual effort, and helping them to have a collective vision beyond the specific and individual effort, to be able to be considered as a group with a common goal and a common objective was a challenge. But once we were able to have the group be considered a coalition, this was very important because it made it possible for the work plans of each organization and the objectives of each organization to be in synergy with the other groups. For instance, this made it possible to work on joint research products, training, development of capacity jointly as well, and also to be able to be consolidated as one single voice with one single message around a communications strategy that was common as well. This was very important first for the internal process of the coalition, as we say in Colombia, to organize things internally at home and to be very clear about who were the different members and what was the role taken on by all of the organizations, which organizations were more academic, which had a greater possibility to go out to external audiences who were mainly decision makers, and to be able to introduce themselves to decision makers. So the Minister of Transportation to Congress as a coalition, as a collective, as a group, with one single voice, with one single objective, with robust arguments, was of the utmost importance. Thank you very much.
Well, thank you.
Thank you, Hema.
First round of questions. I'm sure you could share much more from your experiences, but it's great to hear that many things are connected, even if we're talking about food or security for vehicles. But we can see that the way that we connect is pretty similar. We are now going to move to the second section where I would like to invite you to participate in our poll. So I think Christy will share with you a question, and we'd like you to participate. Please answer, what is your biggest coalition building challenge? Qual é o maior desafio? So finding coalition members, activating coalition members, managing conflicts within coalition, competing interests, or other. If you feel that you could also share through the chat if you have any other challenge that you would like to raise here. So we're going to give you 1 minute to participate, and then we are going to move forward. Okay, I can see people participating here. Wonderful. Do we have, okay, you have some results here. Oh yeah, this is what I expected. The biggest challenge is to activate coalition members. Sometimes it's pretty hard to make people be active and participate, as there are many competing priorities sometimes, and sometimes some organizations are not fully dedicated to that project and participate in many other spaces. So yes, and also managing conflicts within coalition. It's always challenging to work with people, but I'm sure you all have many experiences to share with us about that too. So talking about that, I would like to invite Huyen to comment on some strategies that you have employed in Vietnam to keep a diverse set of members active and engaged. If you could share with us, please. And also would like to invite Francine and Rosa to share us for this session.
Thank you, Vanessa, for the great questions. As you know, since 2018, the Bloomberg Philanthropy announced its partnership with the government of Vietnam for the first ever 5-year program to prevent child drowning. And GHAI is an implementing partner to support the leading Ministry of Labor, War, Invalids, and Social Affairs to carry out and sustain the evidence-based intervention that focus on survival swim and water safety education for the children at the age of 6 to 15 years old. In Vietnam, we start a coalition for the number of 9 ministries and government agencies that already work together before we keep welcoming the newcomer from the mass organization, academic institution, university, local NGO, and mass media agency. So the first strategy from our side is to set up the formal working mechanism. The government ratified the 10-year national program for child injury prevention. So in this very important policy, it helped us leading the ministry to develop the joint action plan for child drowning prevention. It could be like the momentum for all of 9 ministry and mass organization with a very clear common goals with a mantra, benefit, mutual specific target deliverable by each partner. And we can understand what we are now and the approach we are keep moving forward. And within this joint plan, the working and reporting mechanism, financial resources should be very clear. Every partner should be own respected and do the best based on their own function and strength. We also set up the monitoring, compliance, and annual review to secure that every partner can deliver work as promised. It also helps us reduce the possibility of duplicating efforts, eliminate the resources competition among the different partners, and improve our coordination in the community. The second strategy is to show our best appreciation of what every partner have done for the joint program. To do that, we must have a very excellent documentation through the report, scientific publication, and media product. And we open the platform for accreditation, such as the Advocacy Conference, annual report to the government, and the National Assembly on Child Rights Implementation. That is some of the common strategies we have done for the child drowning prevention in Vietnam. Thank you, and over to you, Vanessa.
Wonderful. Thank you, Huyen. Yes, it's always challenging to make people be active, but being respectful to everyone, it's one of the key things, right? So, Francine, I would like to ask you, in Barbados, how has your coalition integrated faith-based organizations, youth organizations, and individuals into its work, and why has this been important for you? How do you decide what types of organizations to include in your coalition?
Thank you so much, Vanessa, and thank you, everyone. Just good to hear the work already that's being done. I'm learning a lot as well. So the Barbados Childhood Obesity Prevention Coalition was actually an idea triggered by one of our regional partners, the Healthy Caribbean Coalition in 2018. And in 2019, the Heart and Stroke Foundation, as the local partner with GHAI in Barbados, officially launched the coalition. Started with a small group. Obviously, the health NGOs and CSOs were obviously at the vanguard, at the front of this work, because obviously it's a health issue that we're dealing with primarily. But what we realized in the Caribbean, and I'm sure it's the same way in other countries, but definitely in small island developing states, beyond the medical authorities, for us to have a strong lobby, we really needed to ensure that there were voices that the policymakers would take seriously, and would have that level of influence on the society. And so we found that, of course, churches and the religious community is still very significant in our region, in our part of the world, and in Barbados. And so we have the Muslim organization, we have the Muslim ladies, as well as our larger Christian council, who are part of the coalition. And so they bring a particular strength and a particular voice to the process. We also found that there were other groups that were significant, especially CSOs and organizations that were already very interested in children's issues, because this was about the young people. And so we had clubs like Kiwani's Club, their international clubs and organizations who were already doing some work in schools with children and so forth, and promoting health and other healthy aspects or healthy lifestyle issues. And so they have also come on board. We found that it wasn't only the organizations, but you also had to look at who were the leaders of the organizations. Because in some cases, the leaders of the organization were major individual influencers. And so, for example, we have the Barbados Association of Retired Persons. It's a very large lobby group as a consumer group, but even more important, the person at the head also carried an influence of her own. So we also looked at that, people who would be influential, not just in the advocacy work in terms of the policymakers, but that when they spoke within the society, because advocacy obviously comes not just with the work we're doing with the policymakers, but the support we're building on the ground among the public. And so we needed that wide range. Also, it was almost impossible to do this kind of work without having your parent-teachers council. If you're talking about childhood obesity prevention, if you're talking about restriction of the sale and marketing of sugar-sweetened beverages in schools, and you're calling for a school nutrition policy. And so we found that there was a real eager response from all of these organizations to be a part. We now have 25 organizations. I think we probably started maybe with about 5 or 6. And over the 2 or 3 years, we have amassed about 25, and it continues to grow to this day. We actually had about 2 or 3 new organizations that have recently joined. So I haven't put them in the count yet, because we haven't really counted up that new group. And so that was one side. The other critical area was that we needed the stakeholder that was critical, and that was our young people. And I'm going to finish here. With our young people, what we found was that clearly you can't do anything for young people without having their voice in it. But even more important, our government, this particular government, also very much considers the voice of young people. They have a strong young lobby or young group around them. And therefore, the voice of our youth subcommittee is critical to getting the policymakers to pay attention.
Great, Francine. Thank you so much. I will take your answer to use your question, your answer to question Rosa about the Brazilian coalition. So the alliance brings together organizations with different voices and advocacy approaches. So how do you reconcile that in the communication efforts and advocacy positions, Rosa?
Obrigada pelo convite, por estar aqui com vocês, é uma honra.
And I thank you for the invitation to be here with you. It is an honor to be with you. And Vanessa, the first point that I can see is really taking up the complexity of a coalition. It's impossible for you to address the communication of a network in the same way that we would address the communication of just one specific organization. So despite there's been a very sort of clear statement, us communications professionals, we kind of need to change the way we think and the way that we work. So as a communicator of a network of organizations, we need to really pay attention and look after a common agenda, which is much more complex and delicate than organizational agenda. So we have multiple power centers, you know, we have people organized differently with different strengths, people who work voluntarily, working together with people who work with resources from their organizations, you know. So we know that working collectively in a environment of trust and collaboration, as some colleagues have mentioned, is something which is not very hegemonic for our culture. So even in organizations that advocate rights, they are subject to this sort of dominant ideology that kind of invites us into competition, you know, working more individually than in partnerships. So in order for us to have an organization that strengthens coalition, we need to be aware of this unfavorable environment for us to do communication at the service of, you know, trust, of working together. And then because for us, this untrust and sort of lack of union has been the sort of social participation. This is an old lesson from social movements, you know, and organizations that work in networks, because social participation in communication processes is incredibly important. It is paramount. And then, for instance, here for the, you know, Healthy Food Alliance, we have a small group of communications professionals, and we look after the external communication of this network, which is done by ACT and Idec. Okay, but we have been implementing listening processes often. So for instance, recently we set up what we refer to as a idea picnic, which are basically courses where we brainstorm ideas, things that we should address on, you know, social networks, news from, you know, the member associations. And then these ideas, they're analyzed by the sort of editing committee that, you know, suggests changes. So us, the communicators, we are not, you know, the law who decide what needs to be communicated on these social networks of the Alliance. No, we work as facilitators, and we work, you know, serving these networks, you know, supplying for the collective demand, of course, helping in any way we can for these sort of common social network products. And as external means of communication through coalition, they need to be the mirror of the debates going on internally in these networks. So we need to be very careful so that, you know, many voices are expressed. So the communication has to be done in a way that you do not give too much visibility to one theme to the detriment to another, or more visibility to one organization to the detriment of the other. So you need to keep this dynamic balance. You need to pay attention to this so that communication does not become a reason for conflict. Thank you, Rosa.
Yes, for sure. There are many ways of overcoming the challenges and bringing all the different voices to be part, to feel part of the coalitions. And you have been doing amazing jobs in doing that. Hope everyone is enjoying to hear your experiences. So I'd like to move to our third section where we are going to talk about challenges, especially related to conflict of interest and governance issues. So I'd like to invite Paula to join us too, together with Francine and Huyen. So I know that bringing diverse organizations together can also lead to conflicts. And I would like to ask Ana Paula and Francine, given your work, I can imagine that a broader coalition can also attract members with different perspectives, opinions related to interference by the food industry on nutrition policies. So this is always challenging for us. Can you comment a little bit about your process to develop an anti-conflict of interests management rules? Or could you share an example of challenging situations that you faced in your day-to-day work?
Yes, sure, Vanessa. Yes, indeed, it's a very challenging work on this issue. From the beginning, the Alliance built a strong conflict of interest policy, which was based on the experience of some researchers and advocates from our group that developed a broader definition of which type of engagement and relationship we should consider, and also which type of industry that would not be allowed to engage as a member of the Alliance. In this process, we faced some challenges, of course. I would highlight here some challenges among allies that were working together with us in the previous experience that I mentioned before. But based on the Alliance policy, they considered that they should not be part as members of the Alliance. One of the organizations was from the Children's Rights Agenda, that had different areas of work inside the organization, and they decided that the Alliance policy may have conflict with these other areas. So they decided not to take part of the Alliance. Another one was an organization that worked on the food allergy movement that also decided to step out because of some connections regarding education materials that they were developing supported by the industry. And a third example that I could add is that our policy also includes that members of the Alliance shouldn't have any engagement with the pharmaceutical industry. So in reality, this decision impacted in the participation of most of medical societies. However, we built a process that the partnership with these organizations were maintained as allies, especially in specific agendas and advocacy campaigns regarding, for example, labeling or schools or other agendas. Just because they are not members of the Alliance, it doesn't mean that we can't partner with them. So we decided to build these layers of engagements, like the example of onions. We have layers of engagement. To be member of the Alliance, we have this strict policy, and we identify that this policy works. But it doesn't mean that in some cases we have organizations that have some kind of engagement with some kind of industry that they identified as important for them. So we identified that we should respect these differences and we can build together. Of course, it's not easy, it's challenging, and we have to discuss a lot about it to build this process along with our experience and with a lot of trust and transparency, as was already mentioned here. These points are very important so that we can make this work. Thank you.
Thanks, Ana. Francine, you would like to share a little bit with us too about that, please?
Oh, definitely. I would say that we are in our early stages. We're still in the honeymoon period. But what we really did at the beginning, because the whole idea and concept of conflict of interest is quite new for us. It's practiced every day, but it is still new in terms of understanding how do you mitigate against it, how do you even identify it or call it what it is. And so we took the position initially with our CSOs was to make it clear from the very beginning what were we focused on? And in our case, it was on the particular policy that looked at the restriction of marketing and sale of unhealthy foods in schools. And since then, we have transitioned to tax, etc., as a team, as a group. But what we identified was the fact that obviously, if you are going to be part of this process, you cannot obviously be in bed in a very significant way with the unhealthy food industry. So what we did, it was similar to Anna, where we do have layers. We have two layers. You can be very active, publicly active. You can also be a member that signs for key documents because you philosophically and significantly agree with the process and the policy ask. And so we've had most organizations be very public and active, and we have had a few of them who've kind of stayed to the background. And we have noted that in their cases, you have found at least two of them. The issue is that they definitely have some level of relationship with food and bev, not one that affects what they think of the policy, but that has to do with their lifeline. And it's actually a significant issue for small island developing states, our CSOs, where are you getting the funds? The same companies that produce unhealthy foods are also producing some of the water unhealthy. So it's an ongoing, and so we took it like that as a process. And so what we've done is created a terms of reference now that organizations have to contemplate significantly, are we going to be a part? So far, we've been getting very good response as we're going through that process now. We've also done training. So we've had HCC, Healthy Caribbean Coalition, been doing some training on conflict of interest. So people then begin to realize, wow, what I'm doing actually is a significant issue for my organization, especially within the work, especially within advocacy work. And so we're seeing the changes. We've seen one organization, for example, one of our diabetes organizations, they were about to do an event. Their sponsor that the agency got for them was an unhealthy product, and they actually turned it down. And so we have seen that kind of work happening. We have one organization that has just quietly kind of departed. We haven't had to ask them to leave. They're quietly departing because I think they're not up to the challenge. But generally, the team, it's still a honeymoon time, and everybody is still very focused on the objectives and the wins.
Great. Well, I'm going to ask you a tricky one now for all of you three. I would like you to be honest with us. Nobody's hearing, don't worry. Have you ever had to reject a group from joining the coalition? So you mentioned a little bit about that in your initial conversation and thoughts, but how did you manage this process if you faced that, and where? And I would like to ask if there were any repercussion with that. Don't know who would like to.
Yes,
start.
we had to reject. And just briefly, we identified that the organization received funds and declared openly how they engage with the food industry and receive sponsorship for events, for example. So based on our policy, we use that document to explain and tell them that they would not be allowed to be part of the alliance. And in some cases, it was not just one case, but in one specific case, they answered back to us and criticized our position and told that we should rethink about it. So it was not easy because it's a decision that was made by the steering committee of the alliance. But we really need to keep these documents up to date and disseminated so that we can have this basis to answer to any kind of problems or rejections that we need to have.
Thanks, Anna. Huyen?
Well, in Vietnam Child Drowning Program, we have not ever reject any group for joining the coalition. But it have some specific case. It take more time taken to build the mutual understanding and trust with the one local NGO. This local NGO is extreme professional on survival stream, and they have a close relationship with the private schools. But if they join our coalition at the beginning stage, it seems that they are too dominant by their professional and elite. So in the first stage, we build a group of nice government ministries and mass organizations. Along with that process, we created a participatory atmosphere, and this NGO is invited only for the technical assistance and observation. So their work support for the quality assurance of survival stream through their field visit. And then after working with the state agency and the ministries and the local authority, they could learn more than their scope of techniques, and they witnessed the comprehensive approach and understanding how important are the components for the program sustain. So 1 year later, we add them as an official member of coalition. So in the coming time, our alliance, our coalition will be expanded to the community of opinion leaders to widespread the value of program through their influences. Thank you, and over to you.
Great, Huyen. Thanks. I don't know if Francine would like to add anything.
Just a very quick one. I think in our case, what we've done is really had the hard conversation with one organization that we noted and asked, what was happening. And so I made the point that that organization then has kind of slowly bowed out rather than us having to have a huge conflict about it. And we found that this terms of reference document that we've created, it outlines everything for both our youth, because our young people are also very specific. They both the youth, the individual members and the organizations have to go through those documents now and say yes or no as to whether they can, whether they feel comfortable to continue on with the coalition.
Great, Francine. Thanks. Thank you all. So our last session is related to growth and evolution. So I would like to invite Rosa, Sanjay, and Hema back to the stage. So Rosa, given that the Alliance in Brazil has been around for many years, can you comment on the evolution of the structure and government process? So 5 years since the launch of the coalition, what are some of the new challenges that you all face there?
Sim, Vanessa, 5 anos, uma pandemia no meio que todos vivem.
Yes, Vanessa, 5 years, a pandemic that we all went through in Brazil, the increase of hunger, the sugary drink and processed food industry ever stronger, and some very weak public policies. I'm going to talk about some internal challenges. And Paula, she's one of the founders of the network, but I see that the Alliance throughout time has been strengthening its identity and also its horizontal reach, because when it is launched, it may be more strongly linked to the organizations who gave this kickstart, ACT, Idec, and throughout the years, the Alliance strengthens itself as a multiple sort of network. So throughout the years, we see efforts to attract people, leadership, organizations with different views that make up this group. We had a lot of investment in structuring this agenda, such as, appraising and offering value to these multiple sort of speakers, spokespeople. And then after a few years of accumulating these issues, these doubts, we built this governance document, which is also very important. And this is the document that describes how we work and the values shared by this network. So more recently, we have just finished the process of drafting a communication policy. So as we have a governance document, we now have a communication policy, which is being finalized. So we went through a very careful process, listening to a lot of people with individual interviews, focal groups, for us to draft a document that would translate the view of this network. And then one of the critical points for us is regional action. And then just a very quick story today. At the moment, at the Alliance, we are funding micro projects for the local centers and from the work groups. So with this funding, the work groups have been doing online courses, for instance, about, children, food, industry interference, and these funds have really served to support these groups. So these are some of the challenges. We have some others, but it's a little bit of what's going on in the Alliance at the moment. Thank you, Rosa.
Just a last question. I'd like you, Sanjay and Hema, to quick comment. If you could go back in time, what would you do differently in terms of the coalition building work? Or what advice would you give yourself if you could talk to yourself in that period?
Yeah, thanks, Vanessa. If I look back 1 year back, perhaps the kind of evolution which has happened, which was really very natural and reflecting, perhaps this was one of the best way to evolve in India in that way, in 1 year time, when everything was really in a very kind of a high speed by the government and the civil society. They have really responded in that way, and we were better prepared on that. So one thing perhaps we could have done or we should do is also get the like organization like WHO and UNICEF more vocal for taking the stand on the FOPL. So that's one thing, because it matters a lot in the this thing. And also my last point would be the research for advocacy and research for whatever the coalition needs are there. So a quick action research, it may not be the per se research, but the evidence generation, quick research, action research would be really very helpful to the coalition, because some of the coalition member who sits in the meeting with the government and others, they need those evidences in hand on that. We'll be happy to answer other questions. Thank you so much, Vanessa.
Thank you, Sanjay. Hema?
Sí, una de las cosas que,
Yes, one
que
of the
aprendimos,
things that we learned.
ahí creo que me escuchan mejor. Una de las cosas que aprendimos
One
en,
of the
en el
things that
proceso.
we learned about over the course of the process.
We are listening to you, Hema. Please go ahead. Sí, te escuchamos.
Okay. Una de las cosas que aprendimos en el
Something
proceso
that we learned in the process of the Vehicle Safety Coalition was that we should respect the time of the organizations much more, in a way, a striking balance between building a coalition that is robust, active, organic, sustainable on the one hand, which is a process that takes time. It takes time to develop trust, that the organizations get to know each other, that they understand the strengths of each organization and the role each organization may take on in the advocacy campaign. This takes a lot of time, but while this happens, policy change opportunities come up, a bill of law comes up, or the possibility of the national government regulating vehicle safety comes up. At that point, you have to take action quickly. You have to be able to answer quickly. So the organizations that feel that are not ready, that have not yet gone through the process of preparation to go out publicly, may feel pressured to take action quickly. So in our view, in the team, a very important lesson learned was to be able to identify which organizations are ready, given their track record, their experience, to be able to take on an active position, a strong public position with a voice towards society and towards mass media and towards the government. And the organizations which are not ready yet, to give them a bit more time, to give them more support, to allow them to be behind this and to be able to clearly identify who is ready to go out to work publicly towards the cause and who may take on a role more of providing support behind the scenes.
Great. This was great to hear you all. We'd like to thank you for being here, for sharing your experiences with us. I don't know if we had any questions from our audience. I saw one related to conflicts of interest in your coalition work. We don't have much time left, but I think you mentioned a little bit in your previous comments. I don't know if anybody would like to add anything about that related to how did you manage any conflicts of interest in the coalition work, if you had any further experience to share with us. But I would like to share with you that we can also answer your questions by email. If you have any further questions directed to our panelists, we are very happy to answer to you. Would any of you would like to add anything related to conflict of interests? Anna, please.
Just to briefly answer Diego, I think that situations of conflicts of interest with people directly engaged with the food industry, we didn't have, because as I said from the beginning, we have these strict rules and we could identify any case of conflict, and we were already denouncing it. The first advocacy activity of the Alliance was a position against Jamie Oliver's activity here in Brazil, which was conflict of interest with a ultra-processed food company here. So I think from the beginning, we already said who we were and what we were looking for, and we didn't have this specific case of directly connections, but these different layers of engagement that we really need to discuss and see how we should partner or not with the organizations.
Great, Anna. Yeah, I remember that. And it was the very beginning of the Alliance, right? People felt they needed to be together and fight about this kind of conflicts. Anybody else would like to add anything related to that, or would like to do any final comment? Oh, please, Francine.
I have a very quick one in terms of while it may not be the actual food and bev industry, but we've had the experience where we're working with persons. So for example, influencers, whether they are not restaurant, but chefs, etc., who then create relationship with organizations that we would have a problem with because they didn't understand what conflict of interest really meant. And so we've had to go through that process. That's actually the one case in which we've had to actually reject a relationship with a chef because he didn't understand. And then when he had been doing work for us very publicly, and then when we realized that he had started a new relationship, we had to end ours. So I think, like Anna said, we're very clear as to what the conflict of interest looks like, but it's coming up with people, again, situations where people want to help, but then they themselves don't understand. And then when they realize what it is, we have to say farewell.
Yes, great. Well, this is the end of our first webinar. This was the first of a global webinar series on advocacy that we are going to be offering, and we will be doing this quarterly. So I'd like to thank Hema, Sanjay, Rosa, Huyen, Ana Paula, and Francine, and all of you that were attending. And we hope to see you soon in our next webinar. Hope you can join us in the future. Thank you so much and have a great day. Bye.
Thank you.
Thank you so much. Thank you, Vanessa.